Welcome to the first part in our four-part Basics of Medicare series. This series is going to include the information you need to know on the four parts of Medicare, Parts A, B, C, and the very confusing Part D prescription plans. Many new Medicare beneficiaries are being bombarded by mail solicitations, illegal telephone calls from out-of-country telemarketers, and if you happen to find someone that you want to talk to, you know they are always telling you that you need to buy right now so you can lock in your price. And that's all just a bunch of hogwash. You know, when you act too fast without all the info is when mistakes are made. So for right now, do me a favor and take all the mail you've been getting and all the pieces of info you've been getting about Medicare that may or may not be true and just put them to the side for me. What we will do by the end of this quick and easy four-part Medicare Basics video series is you will be able to throw away all of that mail. And by the way, we just call all that mail the stack of confusion because literally that's what it ends up doing, is just confusing you. And at the end of this series, you will have learned the basics of Medicare that you need to know. My name is Chris Duncan, and I'm the owner and founder of Trusted Benefits Direct. We specialize in helping those new to Medicare and already on Medicare make sense of Medicare so they can make the best decision for their needs on the right Medicare supplement and Part D prescription plan, or whether Medicare Advantage is best for them. We are an independent agency that represents almost every company in the market, and we help people in all 50 states along with the District of Columbia. By representing multiple companies, we are able to objectively compare all of the benefits from the plans and the costs to make sure you're getting the exact right program at the best cost for your needs. And all of our services are free to use. The way we make our living is when you use us to be your agent to purchase the right Medicare product for your needs. And by the way, Medicare dictates the costs and benefits. They got to be the exact same whether you use our free service or you go directly to the company. What we do is we first educate you on the basics of Medicare, way before we start talking about if you need or even don't need to purchase various products that supplement Medicare. Okay, let's get into this and start talking about Medicare Part A. And this is going to go pretty quick. Here you will see an excerpt from the official Medicare document titled Medicare U. This gets mailed to you every year, by the way. You can see that Part A is called Hospital Insurance. It helps cover inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. For example, covers semi-private rooms, meals, general nursing, drugs, and other hospital services and supplies as part of your inpatient treatment. Notice nowhere does it say your doctor services are covered. And here's a very important statement that comes from the Medicare New Handbook. It states, if you also have Part B, it generally covers 80% of the Medicare approved amount for doctor's services you get while you're in a hospital. What that is saying is that if you are in the hospital and getting services, if you don't have Part B of Medicare, and I'll cover Part B more in depth in the next video, that you'll be responsible for 100% of doctor services that you incur while in the hospital. Now, let's get back to Part A. First thing people want to know about Part A is how much does it cost? And for almost everyone watching this video, Part A is premium free. It is a $0 per month premium as long as you or a spouse paid into Social Security for 40 quarters or 10 years or more. If you didn't qualify, give me a call and we can discuss the specifics because you can actually buy Part A. So as you know, Medicare doesn't cover 100% of the bill. When you have Part A of Medicare, there are deductibles, co-pays, and co-insurances you are responsible for. And as a side note, every cost I'm about to outline can be covered when you purchase a Medicare supplement policy, also known as a Medigap policy. I also have a video devoted to Medicare supplements. So when you are admitted to the hospital as an inpatient, you're responsible to pay the Part A deductible. And all these dollar figures that I give, they're for 2021. If you're watching this after 2021, the costs are very likely just to be a little bit higher. And in 2021, the deductible for Part A is $1,484. This covers you for each benefit period, which lasts 60 days. If you are in the hospital for over 60 days, you're responsible to pay $371 per day for days 61 through 90 of your stay. For hospital stays lasting longer than 90 days, you're responsible to pay $742 a day until you exhaust your 60 additional lifetime reserve hospital days. And after those lifetime reserve hospital days are used, you don't have any more extra days beyond the 90. But if you have the right Medicare supplement or Medigap plan, you don't have to worry about paying these costs. The next set of costs you could be responsible for is if you go into a skilled nursing facility. Now, there is a maximum benefit of 100 days of coverage per benefit period. Fortunately, the first 20 days come with a $0 coinsurance payment. You're not responsible for any money during the first 20 days. However, for stays lasting longer than 20 days, you're responsible for a coinsurance of $185.50 per day. And if you exhaust all 100 days, you'd be responsible for $14,840. But again, if you get the right Medicare supplement plan, the plan can pay all of those costs. That's all I have for today's video. Told you it would go quick. So a quick recap. Medicare Part A is called hospital coverage. It covers inpatient care in hospitals, skilled nursing facility care, hospice care, and home health care. However, Part A won't cover you for most doctor services in the hospital. That is Medicare Part B. Last, Part A has a series of deductibles, coinsurance, and copays you are responsible for. And because we know Medicare doesn't cover 100% of the bill, you can purchase what is called a Medicare supplement plan, also called Medigap policy, to pay those deductibles, copays, and coinsurance that Medicare doesn't pay for. Again, I'm Chris Duncan. If you have a question about this or anything else Medicare related, I'm here to help. I help with Medicare supplements, Medicare Advantage, Part D prescription plans, dental, vision, hearing plans, final expense life insurance, also called burial insurance, protecting retirement savings, and more. If you'd like my help, easy to contact me, 800-910-3382, and I look forward to seeing you in our next video.